everybody! Dr. Eric Herman, the Guru Chiropractor and official Team Ringdinger Doctor of the Northeast of the US of A. Back again with another video and another new patient. Big Rob. Robert? What do you prefer? Robert, Bob, Rob?
Rob's good.
Big Rob coming, well, from a little down south. How long did it take you? About 30 minutes to get up here?
Yeah, about 30 minutes.
Yeah. Little down south on the beach. He's got a cool little place. But originally from Staten Island.
Staten Island, New York. Yes, sir.
Yeah. Never, doesn't even know about the Ringdinger.
Coming in blind.
Never saw a video even. His buddy, what's your buddy's name again?
Frank.
Frank is one of my patients who came and did well and just referred him, and he trusts Frank, right?
Yep.
So he's here for a visit. The main problem is he's got lower back pain and dominantly right sacroiliac pain, but a little bit on the left. And a little bit of pulling going down that right hamstring, right glute and hamstring to the knee, which is probably sciatica. You have what's called positive Valsalva maneuver, which is when I asked you about the sneezing and the coughing, and you said it makes it worse, which is not a 100% diagnosis, but because of that, I'm suspecting he's got at least a bulging disc, maybe a herniated disc. But that's what the Ringdinger is the best in the world, in my opinion, at correcting. So we came to the right guy for that. It's been going on for 2 years.
2 years, yeah.
So it's borderline getting chronic.
Yeah.
And pretty constant too, which is nasty.
Yeah, every day.
On the average, you told me the pain is about 5 or 6.
5 or 6, yeah. Every day.
Right now, it's about right over there when we were doing the health history, you said it was about a 4. But it maxes out at 7, 8. Like at the end of a busy work day and stuff, when you push your body, it jumps up, which is also really nasty. So I feel for you, and I'm going to do everything I can to get that eased up for you today. We did the exam. We did the health history. No red flags. It's safe to treat. And he definitely has the conditions that I treat successfully on a regular basis. So I'm pretty confident that this is going to do well for him.
Thank you.
Yep. Anything you want to say? Did I miss anything?
No, I'm excited. Let's see.
You ready to go?
Let's do it.
Okay. Your job, like I told you in the exam, but I'll say it again for the camera. Stay as relaxed as you can. Okay. And give me a heads up if anything doesn't feel right or, you're not feeling right about something. Talk to me, communicate, and we'll work through it. But I can't read, because I can't read your mind. Sometimes I can read body language, but I can't read your mind. So if you communicate with me, trust me, bro. I've, been doing this almost 30 years. So I've seen a lot of things and dealt with a lot of things. If you communicate with me, we'll work through it effectively.
I'm excited.
All right. You ready?
Let's do it.
All right, go face down, get your body comfortable again.
All right.
We're going to start with that massage that I was telling you about. Okay. We're going to just loosen you up first with my trusty massager called the Thumper. Is that sore when I'm running it? Or feels good? Yeah. Like it's good. Perfect.
Price of admission alone.
There you go. You ain't seen nothing yet, buddy. This is just a warm-up for the big stuff. I'm not trying to make you nervous. More effective than this is what I'm trying to get at. Nice little, just getting some blood flowing, warming up the area so it's looser, with the intention of getting it looser will help me get a better release down there, because we got to release, it's all jammed up and it's compressed. We got to release that. You okay up here too?
Yeah, it's ticklish.
A little ticklish. Some people can't handle it close to the head and neck because they say it's too intense or they get dizzy or something like that.
Nothing wrong, just a little ticklish in the upper back. It's all fine.
Yeah. Just, if you need me to ease up or stop, use your words, not your hands. Don't smack me, don't punch me, don't kick me. Yes, you laugh. It's happened before. That's why I warn you. Like a dog, when you get on a sore spot on a dog. Reaction. And you've had chiropractic before. Did you have chiropractic visits for this particular issue?
I think I did start back when it first flared up.
Yeah. Obviously didn't resolve it because you would have not come here and you would have been sticking with them, I'm assuming, right?
Yeah, no, it didn't do me anything.
Yeah.
I tried physical therapy, massage therapy, you name it, I've tried it at least once.
Yep.
Besides the ring thing.
Yep. Well, again, we talked about it off camera. Most chiropractors, they push on your back and they twist. And it helps a lot of people. I'm not saying bad things about chiropractors that don't do the ring dinger. That was me for 20 years. But what I noticed, what I observed clinically is when I added the pull in, it skyrocketed my results. Helped more people and I helped worse, and I was able to help like some of the worst cases that weren't responding that well before, where all of a sudden started to respond better. I know it's a little ticklish. Good. All right, just a little warm up. So when you feel ready, slow and easy, no jerky movements, come on up from this table, come on up on your feet again, and we're going in the back room, which is where the ring dinger table is, and we'll get you set up on that. Good. Take it slow. Now, I got to feel the top of your hip bones because I got to line you up a little better on this table. Right there. Slide down about 5-6 inches towards your feet. Right there. Hey, look at you. Perfect. Now, you just work on getting relaxed. Keep breathing. Nice breaths. I'm raising up the table first, basically just to the height that I prefer it at to do the procedure. And second thing it's going to do is going to lift up your knees. So just let the table lift you up. Try not to wiggle. Let your legs bend as it comes up. Let them relax and bend. Good. There you go. What this does is it flattens out the lower back and relaxes it and makes it easier to decompress. Now, I got to pin you in really tight here above your hip bones because when I do a little pull on your neck, I don't want your body to slide. I want it to stop short, which allows that force to get it all the way down from the top of your neck to the bottom of your tailbone. The bottom of your spine and the top of your tailbone, and releases whatever needs to get released. So it's going to be a little snug in here. Just let you know, heads up, okay? With these padded pins. Don't shift. Stay right there. Good. Do. All right, let's see if that's too much. Can you handle that? Good man. Good. All right. Now, let me have your hands back to me. This is not the treatment. I'm just making sure you're pinned evenly and there's no slack. See how it squeaks a little bit? There we go. Now you're good. Keep them here again, relaxed. Now, I'm going to put a towel around your neck, but it's really not on your throat. It's not going to be choky. It grabs the back of your skull like this and underneath your jaw like this, okay? Because my hands are too small to get a good enough grip, so the towel gives me better grip. I'm explaining everything for you because you're a newbie and for the people that might be watching out there that never seen this before. I just spritz the towels just for better grip. Good. Lift up your neck and drop it down. Good. Now, I am going to do a little tug in a second. I want you to keep your teeth closed, touching and closed together, right? So that when I pull, you don't bang your teeth or, God forbid, bite your tongue. But don't bite down hard. Just keep it naturally closed. You know what I'm saying? All right. So the first thing I'm going to do is I'm just going to pull a little bit and stretch, kind of traction your spine, but I'm not going to do a big tug yet. I want you to kind of feel that lengthening in there and try to keep your body as relaxed as you can while it's stretching, okay? 5-7 seconds, then I'm going to let you back down again, have you take a couple deep breaths to relax even further. Then I'm going to stretch it a little more, and then from that stretch, I'm going to do a little tug. And usually what people feel is, you know how when you get pop your knuckles or when you get an adjustment, you hear popping in your back? Probably going to be popping, like pop, 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 all the way down to the tailbone. Most people who are not in really severe pain, it doesn't hurt at all. So just stay as relaxed as you can. You ready?
Ready.
Okay, so first we're going to stretch. Nothing else but just a little stretch and a little traction. Feel how that's elongating?
Oh.
You feel it all the way down to the hips?
Oh.
Good. Nice and relaxed. Try to keep your body as relaxed as you can while this stretch is happening. Good. Good. I'm just letting it down. Nice and slow. Good. Take a deep breath in. Exhale slow. Let your body relax even further. Relax your feet, your toes, your glutes, your back, your shoulders. Nice and relaxed. Let everything go. Now we're doing another stretch. Stay as relaxed as you can. Just breathe in and out through your nose. Just doing a little stretch, elongating the whole spine. Good. And breathe, 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 breathe. Woo, that was it. You good?
Good.
Nice. Did you feel it all the way down? Pop, pop, pop. That's the ring dinger. Now you know. Now you know. Because you can watch a million videos, but you really don't know this till you feel it. Intense?
Yeah.
Yeah. Painful? Yes or no?
No.
Yeah. Most people say no unless, like we were talking off camera, I get the worst of the worst sometimes crawling in here. Those guys, nothing I do this and they're screaming, you know what I'm saying? Those guys, it might hurt, but very temporarily, and then it starts feeling better. Let me lower the legs. Anything going on in there? Some people feel sensations.
No, okay, no.
Good. I didn't ask you before we did anything, but when you were laying on your back before we did any adjustment, were you feeling any pulling or pinching or anything like that?
On a flat surface. Yeah.
That's what I'm saying.
Yes.
How about now?
Nothing.
Gone or reduced?
Gone.
Dude, that's a major sign that this was successful. Great. I'm lowering the table because it pulled out all that jamming.
Yeah.
And decompressed and hopefully got the pressure off that nerve going down your thigh. I'm pulling this out. Stay right there, though. Don't get up. Before you get up, I want to do a little check in your neck and maybe do a little more release spit on you. The traditional chiropractors. A little pop twist, okay? Stay relaxed. Let it go. Drop it down. Heavy, heavy. Good. Relax your shoulder. Heavy, heavy. There you go. Beautiful, beautiful, beautiful. Okay. Done here. I think the worst part of the whole procedure was when I spit on your face by accident. Let's get it right. When you feel ready, go slow and easy. Come on back up on your feet. The best way to get up when you got back issues is not do a sit-up. That's the worst way. Turn your body sideways. Let your legs come off and then kind of push yourself up with your elbow with the least amount of flexing forward as you can do. Okay?
Yeah.
And go slow. No jerky movements. Jerky movements are bad for back problems. There you go. Perfect technique. Good. Nice. Now, when you stand, stop for a second once you're standing. Feel your body move around a little bit. Test it out a little bit. Tell me if you feel any different than you did before we did anything.
Say about 70 to 80% better than it was.
Nice.
You remember before I could barely pick up my wallet.
I remember you were showing me that. That was like the biggest,
Yeah, now I can go all the way down.
And
up.
zero or just a little bit of a...
Smallest amount of tightness still there, but nothing like it was before. That's
Again, major sign of improvement. Good job. Was it as bad as your mind was telling you it was going to be? No. Good. Usually that's what happens. The mind catastrophizes it, and then once you get it done, you're like, nah, it wasn't as bad as I thought.
Not at all.
Good. I'm happy. And you did great. Come on through. We got more to do. Walk around, see how it feels walking a little bit, and then when you're ready, go back on this table where you were before, belly down. Yeah?
Yeah.
Good walking too?
Feels good, yeah.
Dude, your gait is pretty normal right now, so that's a good thing. Cool. Making progress. Now, I'm going to redo those couple tests that I did off camera when we were doing the exam.
Yep.
Remember the first one when I bent it up? You said it was pulling all the way across here?
Of course.
Yes. So I'm going to rebend it. I want you to tell me, does it feel the same as before, or is it better and improved? This is also a measurable way to tell whether we've made progress, whether you're getting benefits or not. How does it feel now compared to before?
Not as tight, but I still could feel it in the same spot.
Got it. But reduced as far as the pulling?
Definitely.
What percentage would you say?
70, 80.
Oh, dude, so significantly reduced.
Significantly.
Wow, we're doing good, bro.
I can feel it, but it doesn't hurt like it was before.
Great. That tells me this is exactly what you needed, and you're making big buku progress. And when I push on it, it's definitely not as jammed as it was. Okay, now we're going to do some more technique here using what's called the drop technique. Did any of your other chiropractors where the table pops up and they push down on you and the table drops?
I don't think so. No.
All right, so slide down about an inch or two. Right there, good. Now, I'm dropping the belly part. There's a trap door for pregnant women and guys with big beer bellies. But this gives me a little more space in here to get a deeper release here, right? The table's automatic. It's going to pop up in a second. Boom. And then I'm going to be doing some pushing down on you. Well, must have been, oh yeah. I got to loosen this up. My last patient from yesterday was an ex-Rutgers football line defensive lineman, 320, big boy. So I got to loosen it up for normal guy mode. Actually, we did a video with him too. That's gonna be a good video. He was a big boy. Good. All right, stay as relaxed as you can. Relax it, relax it. You okay?
Good.
Nice. Coming around on the other side. Now we're going to go up the spine a little bit in the lumbars. This is L5, S1, probably where you're having most of your pressure and pinched nerve. Good. Let it go. Oof, major crunchy right there. Now we're going to hit the sacroiliac a few more times. You okay?
Yeah.
Good. Very nice. Okay. I'm going to rebend it. Tell me if it feels even better or about still 70% improved. Or if it's better, let me know. If it's better than 70. How's it doing now?
Only when you come so far up do I even feel it. I would say, you just keep it at regular. I don't even feel anything.
Very good. All right. I'm telling you, when this happens, people start getting well. So I'm pretty excited for you. Now let's do that stiff leg lift. Remember when it only went up like a third? And you said it was pulling here? So start again with that left leg. Lift that. Now lift it as high as you can. Okay. Down. What do you think? Visually, it went up about 2 or 3 inches higher than it did before.
Yeah,
did it feel easier to lift?
Yeah, much easier.
Less pull here?
Yeah.
Amen. Now let's do the worst side. See how that goes. Look at that. Now it's about, 50, 70% of normal range of motion. It's still not perfect, but you were at like 30%. We didn't film it all off camera when we did the initial exam. Did anything pinch when you lifted or pull?
No, not as much now.
Very good. All right, you're on the mend, brother. I'm declaring you officially on the mend. Okay, now we're going to work up here. I know you're not complaining. Well, a little bit up here. You told me it was tight. So we're going to release the rest of your back a little bit. Let me see. Make sure this is looser for you. Stay loose. Take a deep breath in. Exhale slowly out. Let it go, let it go, let it go. Good. Deep breath in. Exhale out slowly. Let it go, let it go, let it go. Very good. Good. Now we're going to do that lower neck, upper back, where it was really tight from your forward head posture. Plus, these moves here are going to actually help bring your head back over your body. You okay? Mm-hmm. Good, man. Nice. Very nice. Do-do-do-do. Nice. Much looser in the traps. I don't know if you could tell yet.
Yeah.
Probably when you sit up, you could tell, but this is like, the word, you ever hear the word mushad?
Yeah,
It's mush, baby. It went from rock hard to mushad. Michelle knows mushad too. A little bit more here. Relax it. Nice. All right, cool. When you're ready, big man, roll over on your back, face up now. We're going to do a little work on your front, which 999 out of 1,000 chiropractors don't work on the front. They only work on the back. Slide down about 2 or 3 inches. Right there, good. We're going to release the collarbones, the clavicles on both ends, and a little bit in the front of the shoulders and a little bit in the front of the ribs, which helps. You know when your head comes forward, we talked about that before. Also, people have a tendency, their shoulders round forward like this, which you have some of that. All the moves I'm about to do now is going to help release your shoulders so they become more squared up on top of your body. So bring your arms out, make a T with your body. Yep. You comfortable there?
Yep.
Okay. This, gonna do the top of the clavicle. See, already somebody's knocking. They're not reading. They're not reading the sticky note. Good. Now we're doing the other side. Good. Stay relaxed. Good. All right, rest your hands up top. We're done there. Now we're going to do a little knee tug and a little ankle tug from down here. Should release the knee and the ankle if it needs it, but also maybe get more release up here. Your job to help me out, just give me a loose, floppy leg, okay? Drop it in my hands, loose and heavy and floppy. Let it go. Let it go. Good. You okay? Great. Slide back up. Did you feel anything up here? Good. A little bit higher up towards your head. You okay getting your toes popped?
Yeah, that's fine.
Some people are freaky, so I always get permission. I had one guy beat me up when I grabbed his toes. Boom. Bang. All right, now we're going to do the ankle. Drop it and loose. Loose and floppy. Let it go here. Good. Now we do the same thing on this side. First the knee, then the ankle, then the toes or something like that. Drop it. Let it go. Oof, that knee opened big time. Slide up. That was good. Relax. Woo. There we go. Let it go. Drop it in my hand. Good. All right. Now we're going to do the shoulder, the ball and socket. So slide up about a ½ inch towards your head. Right there. Stay right there. Bend the elbow. Stay as relaxed as you can. Nice. Same thing on the other side. Bend it up. Stay loose. Let it go. Helps if I cock it up. Sorry about that. Drop it, drop it. Nice. Okay. We're done on this table. So come on up like I showed you in there. Try to roll. And then feel how it feels getting up, because transitioning up and down, you know, you lived it. When people with back problems have a hard time transitioning.
Yeah. No,
How'd that feel now compared to how it usually was?
phenomenal.
You do it. No BS. You're doing great. You're doing good. All right. We're almost done. Come sit here again, face that way. I want to just do a little release in your elbows, your wrists, and your fingers, and that will complete the full body release. Okay. Then I'm going to recheck. Hang on, this heater's killing me. Then we're going to recheck your forward head posture. Remember we talked about it. We would see if it reduced. See how that's going. Then we're going to talk about how you're feeling a little bit, and then what to do next. So just drop this in my hands, heavy and loose. Nothing crazy in the elbow, just a little thrust. Good. Now we do the wrist. Pull back a little bit. Pull. Good. Good. Again, pull back. There we go. Big release. What's going on with these painted fingernails?
4-year-old.
All right. Oh, your 4-year-old did it for?
She tried.
Aw, that's sweet. You let your 4-year-old do your nails?
Twice.
Drop it.
Toes too.
Relax. Good. 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 Let it go. Pull. Pop. Bink. Bop. Boop. Bang. Boop. Done. Now, sit up normal again. Face the camera. Well, actually, turn this way. Now, sit up normal. A little bit straighter. Last time I checked it off camera, it was about 3 1/4 inches, which is pretty severe. So let's see if it made any improvements. Yeah, remember I wasn't even touching your ear the first time? So again, I'm estimating because I don't use a measuring device. 2 1/4, so it came back a whole inch with one visit. That's pretty remarkable compared to the other techniques I used to do before the ring dinger. So that's going to help stabilize your spine even more without as much of that weight yanking this way.
Okay.
Now, question. You told me your back pain was about a 4 out of 10 when you walked in here. What number would you give it now?
1.
Dude, good improvement. Do you have any sensations coming down the left,
No.
the right thigh and the glute?
Yeah, I really don't feel much.
The pulling and the tightness that you said was chronically there?
Yeah,
It's completely gone?
nothing.
And I didn't tell everybody out there, I didn't pay you to,
No,
I didn't give you any incentives. I didn't give you a
No,
discount. Dude, that's good. I'm just messing around, but that's remarkable.
Yeah.
You did above average symptom relief wise for first visit. So I'm expecting really good things. This doesn't mean you're 100% fixed. You might need to follow up for 1 or 2 more. Here's how to tell. Wait a few days to let it heal, because now you got to heal a little bit. You might have a little some people have a little up and down as it's healing, and then it could be better over the next 2 to 3 days. So I'd say wait 2 or 3 days. Try to take it as easy as you can over the next couple days so that you allow it to heal maximally. Because if you get too active, you could re-injure it, and you could kind of sort of get in the way of it healing as much as you could. If you get sore, some people get sore as hell from their first pull, and some people don't. At this state, the honest truth is I don't know, but I prep everybody just in case. Ice will be your best friend. Applied ice wherever it's sore. Like 20 minutes on per hour is a good regimen for icing the body. It'll help reduce the inflammation, even cut down on if there's still any pain going on there, and any swelling. It'll also help shrink that quicker than if you don't use ice. If you feel like after, like I said, 2 or 3 or 4 days, that it's significantly better and that you feel like I already know this is what you needed. But if you feel like, yes, this is what I needed, but it's not fully fixed yet, you still feel like there's some jamming hanging on and there's still a little pain going on, that basically justifies coming back for another follow-up. Usually when patients do that quickly, then they respond even further with better results. So my best recommendation for follow-up would be come back in a week. If you can't, I get you time and money, and I guess life gets in the way. Even if you come back in 2 weeks, I've still had great results. You might have a little bit of a backslide in your symptoms if you wait a little too long and it's not fully fixed yet, but it's not going to kill all the results. So I'll leave it up to you. Reach out to Zach when you feel ready. Also, if you have any kind of issue over the next week or so, if you feel a certain way where you're concerned, occasionally you have healing symptoms and people get a little worried about that. Like if anything's going on that you don't feel happy about, reach out to Zach, let him know. He tells me and I'll get on the phone with you and we'll make sure you're okay. We'll just do a phone check-in. But I don't think it's gonna happen. But if it does, don't be out there alone worried. Let's talk about it, make sure you're okay. And I'll make sure I'll be available for that.
Yes, sir. Thank you.
Cool, man. You did fantastic, dude.
Thank you so much.
Ideal. I wish all my patients responded as good as you. You have anything last minute to say? I don't want to put you on the spot, but if you don't, all right, cool. You're very welcome. If you need me in the future, I'm 100% here for you. Do my best for you like I did.
I'll be back next week.
You the man. All right, let's say goodbye to the audience out there.
Thank you.
Big Rob, Guru Chiropractor, peace and love to everybody out there. If you're watching and you're like, damn, I got stuff going on too, and you're kind of relating and you're suffering and nobody's helping you, and you want to give this a try, I would be honored to serve you and try to do my best to help you. Just reach out through my website. It should be flashing on the screen, guruchiropractor.com. There's a book now button. Is that how you did it? Or your buddy Frank gave you the number? Okay. There's also a direct line. We do text only for onboarding, 908-224-3080. Or go to my website, click the book now, enter your name, your email, and your cell phone number, and it goes to my assistant, and he reaches out to you via texting, get questions answered, and if it works out and you're happy and satisfied with all my terms and my fees and my policies, he'll also be able to help you book an appointment. And if you get here, I promise you from my heart that I'll do my very best to help you with everything I got like I did with this guy. I love and appreciate everybody. God bless you. Out.